Laboratory testing of a capillary blood specimen is often performed in the medical office. Examples of such tests are hemoglobin, hematocrit, glucose, and cholesterol. A skin puncture must be performed to obtain a capillary blood specimen. The medical assistant is responsible for performing skin punctures in the medical office. To prevent a needle stick injury, OSHA requires that a retractable Lancet device be used to perform the puncture. The medical assistant will first show you how to perform a skin puncture using a disposable Lancet device. The blood specimen will be collected in capillary tubes for testing in the medical office. Before proceeding, sanitize your hands. Greet the patient and introduce yourself. Identify the patient by asking the patient to state his or her full name and date of birth. Compare this information with the data in the patient's chart. If the patient was required to prepare for the test, determine whether she has prepared properly. If the patient has not followed the preparation requirements, you may not be able to obtain a quality specimen. Notify the physician for instructions on handling this situation. Assemble your equipment. You will need a disposable Lancet, an antiseptic wipe, sterile gauze, capillary tubes, and an adhesive bandage. Explain the procedure to the patient and reassure her to reduce apprehension. Make sure the patient is seated comfortably in a chair. The patient's arm should be firmly supported and extended with the palmar surface of the hand facing up. Select an appropriate puncture site. Use the lateral part of the tip of the third or fourth finger of the non-dominant hand to make the puncture. If the patient's finger is cold, you can warm it by gently massaging the finger 5 or 6 times from base to tip. This increases blood flow to the area, which promotes bleeding from the puncture site. Open the sterile gauze pack and lie it flat to allow the gauze pad to rest on the inside of its wrapper. Cleanse the site with an antiseptic wipe. Allow the site to air dry to give the alcohol enough time to destroy the microorganisms on the skin. Drying also prevents alcohol from entering the blood specimen and causing hemolysis, which can lead to inaccurate results. Also, if the site is dry, a round drop of blood will form on the finger, making it easier to collect the specimen. If the site is not dry, the blood may leach out and run down the finger, making it difficult to collect. After cleansing, do not touch the area. Wipe the area with gauze or fan the area with your hand. All of these actions can cause contamination, and the cleansing process has to be repeated. Apply your gloves as a barrier precaution against blood-borne pathogens. Firmly grasp the patient's finger in front of the most distal knuckle joint. Apply enough pressure to cause the fingertip to become hard and red. This ensures that adequate penetration and depth of puncture will occur. Position the blade of the Lancet perpendicular to the lines of the fingerprint on the fleshy portion of the fingertip and slightly to the side of center. Puncturing the side of the finger can cause the Lancet to penetrate the bone. Tell the patient she will feel a small stick. Firmly depress the activation button without moving the Lancet or fingertip until an audible click is heard. This causes the Lancet to puncture the skin and then retract into its plastic casing. Moving the Lancet or finger too soon can lead to an inadequate puncture and poor blood flow. A well-made puncture results in a free-flowing wound that requires only slight pressure to make it bleed. Immediately dispose of the Lancet in a biohazard sharps container. Wait a few seconds to allow blood flow to begin. Wipe away the first drop of blood with a gauze pad. The first drop of blood is diluted with alcohol and tissue fluid and is not a suitable specimen. Use the second drop of blood for the test. Allow a large, well-rounded drop of blood to form. Apply gentle, continuous pressure without squeezing the finger. You can massage the tissue surrounding the puncture firmly but gently to encourage blood flow. Squeezing or massaging the site excessively causes dilution of the blood sample with tissue fluid, leading to inaccurate test results. Collect the blood specimen. This specimen is being collected for a hematocrit determination. Ask the patient to hold a gauze pad over the puncture site and apply pressure until the bleeding stops. Process the blood specimens by sealing the hematocrit tubes with a sealing compound. As a safety precaution, remain with the patient until the bleeding stops. If needed, apply an adhesive bandage. Remove your gloves and sanitize your hands. Transfer the capillary tubes to a laboratory work area and test the specimen according to your medical office policy. The medical assistant will now show you how to perform a skin puncture using a reusable Lancet device. Sanitize your hands. This time, when you assemble your equipment, obtain a Glucolet 2 reusable Lancet device. You also need a disposable retractable Lancet which is housed in an end cap. Also assemble an antiseptic wipe, sterile gauze, and an adhesive bandage. Push the transparent barrel of the reusable device toward the release button until it clicks into place. Insert the end cap onto the reusable device. Cleanse the puncture site and allow it to air dry. Apply gloves. Using a twisting motion, remove the plastic post from the end cap. Grasp the patient's finger and position the Lancet. Firmly depress the activation button without moving the device or finger until an audible click is heard. Pressing the activation button causes the Lancet to puncture the skin and then retract into the end cap. Wipe away the first drop of blood and use the second drop for the test. Allow a large, well-rounded drop of blood to form and collect the blood specimen. This specimen is being collected on a test strip for a blood glucose determination. Ask the patient to hold a gauze pad over the puncture site and apply pressure until the bleeding stops. Test the blood specimen as required by your medical office policy. Apply an adhesive bandage to the patient's finger if needed. Remove the end cap from the reusable device and discard it in a biohazard sharps container. Remove your gloves and sanitize your hands.